Okay, so okay, we're gonna get started. If this is your first WCVIS, thank you for coming, and those of you joining us again, welcome back. Today we have a panel of how to ace your IROA rotations, and we have an amazing panelists of 3M4s, and I'll let them introduce themselves later on. But my name is Ryan Yu. I'm a third year med student at Rush, and I'll be the host and moderator of today's event. For those of you who are new, I just want to explain what WCVIS Chicago is. We're pretty much a student-run organization with a mission to foster an early education and exposure to the field of interventional radiology and endovascular interventional surgery. Our aim is to connect surgically minded trainees in Chicago with a deep interest in minimally invasive approaches to patient care. We seek to clarify that this field is intended for trainees interested solely in surgery and hands-on patient care, rather than those interested in image interpretation. So first, I just want to plug our little link tree. Just helps everyone get connected with what we're doing because we have a lot of good events coming up in the near future. And on this link, you can sign up for our membership form, which kind of, like I said, gives you like updates on what we're doing, um, future events, kind of anything that's kind of new in the field of IR as well. The next one is the mentorship program. So we are planning, so you can apply to be a mentor or a mentee, and our goal is to start matching and pairing mentors and mentees by the end of this month. So if you are interested, feel free to fill out that form. Our next is the Chicago School Representative, which we designed so that there's a designated individual where you guys can reach out to who represents your medical school, which you guys can reach out to kind of find ways to get involved if you're interested. The next one is our group meet chats. They'll just give reminders of events like today's events as an example. And the last one is our YouTube channel. We have actually two videos up right now. If you guys are interested to watch those, we have one, a day in the life of an IR resident, and an educational series from the IR playbook. So yes, now I'm going to introduce our panelists. So if Camille, you want to introduce yourself.
Yeah, for sure. Hi, everyone. I'm Camille Tomasek. I'm an M4 at Rush, originally from the Southwest suburbs of Chicago, Irvingville area. I'm a first gen Polish American, kind of a non-traditional background. I went to a community college first, got my associates in nursing back in 2019, and then my bachelor's in nursing in 2020. Some of my hobbies, I like making wooden pens, hiking, rollerblading. And of course, I'm like a Costco fanatic, so just going to Costco and finding new things. Their newest, latest thing is a cookie dough bar cake, which I highly recommend.
Cool. Oh, sorry. Next is Faisal.
Hey guys, my name is Faisal. I went to just a little bit about me. Born and raised in Illinois, southwest suburbs, kind of like Camille. Went to undergrad in Urbana, and then now I go to the University of Illinois in the Peoria campus. And then yeah, you can see my hobbies: like playing soccer, kayaking when it's a little bit warmer out, hiking, and then just some other stuff.
And last but not least, Zach.
Yeah, hi guys. My name is Zach. I'm a M4 at the Chicago Med School. Um, from Palatine, Illinois, from northwest suburbs. Went to undergrad at DePaul University, where I majored in the health sciences. And then some of my other hobbies, I like to play volleyball a lot in my free time, travel, play music, and then also big foodie. I love to explore. Chicagoland's huge for all that, so I'm sure everybody's familiar with that. And then yeah, we'll get excited to be here. Excited to talk about our IR way experiences.
Awesome. Yeah, thank you guys for the introductions. And yeah, I'm very looking forward to what you guys have in store for us because this is actually an amazing opportunity. And thank you for taking some time out of your day to talk with us today. So now we're going to go to our Q&A session. So I have a list of a couple questions, but if anyone in the audience has any questions that they want to ask the panelists, you're more than welcome to raise your hand or type in the chat, and I can um, call out whoever, and they can ask the questions. Okay, perfect. So I guess the first question I have is where did you guys go do your away rotations, and what factors did you guys consider in choosing those sites?
I guess I'll start off just because I'm unmuted. I went to both the Peoria and the Chicago campus for UIC. Then I went to U Chicago and then University of Michigan. Main things that I was kind of considering, especially for the first three, was living costs. Going out of town and spending, 2 or 3 grand. I didn't really want to do that as much. University of Michigan, I stayed with my sister for half of it, so was mainly just trying to kind of avoid too high of costs. Second thing was just kind of staying in the Midwest. Felt like that's where most of my connections were. I got some mentors that kind of advised me. I told them what I wanted to do. Um, and yeah, like I guess the only one that was quote unquote random was more University of Michigan, but that's just because I had family there. And one of my mentors really highly recommended it. Like basically said that they do a lot of high work. They still do TVARs and like a lot of Venus recans, which I really liked. That's kind of how I chose.
I can go next. So I also did three aways, including home. So four total. I went to MCW Medical College, Wisconsin. Then I went to University of Virginia out in Charlottesville, and then went to University of Colorado in Aurora, which is like a suburb out of Denver. The way I kind of picked it, again, I had some mentors, kind of talked with them. I was really looking for clinically focused IR programs, so ones that specialize not just in the, interventional suite, but also on the floors, admit their own patients, have a clinic, follow them kind of throughout their hospital stay. That was really big for me. That's what I was looking in for a program. Location was another thing. So just for myself, I wanted to kind of see what else is out there outside of the Midwest, just because I've been here kind of all my life. So I wanted to kind of get a understanding and a feel for how different IRs practice across, kind of the country. And then again, I think just the mentors I talked with, they really like hyped up those programs. I think every program has its pros and cons, which I'm sure we'll get into later on this session, but that's kind of how I chose and went about it.
Yeah, and for myself, I did about 4 IR rotations as well. My situation was a little bit more unique in the sense that I didn't necessarily choose two of them. Being in the military too, we are required to do some active duty rotations for healthcare. So I ended up choosing to do both two of my IR rotations at military facilities. So one of them was at Walter Reed in DC, and one was at San Antonio Brooke Army Medical Center in Texas. And then a third one came back here and did it at Northwestern University. Kind of similar to what Camille was mentioning, I was really looking for a lot of clinically minded programs, but I also did a couple of informal rotations, mainly like smaller 2 week sides at some more consult service type of IRs, just to get a good breath of how all of it feels like, how the practice volumes are different. And so, yeah, it was overall really good, rewarding experience, well rounded, I feel.
Very awesome. Yeah, you guys mentioned a lot of like good things to consider when us as M3s or M2s like consider like away rotations. I guess another question is like, what tips do you recommend for med students going into their first IR away rotation and having like absolutely no experience with like handling a wire or catheter?
I mean, I guess the most basic is just not having an ego and also like getting the techs and nurses and asking them questions. Because honestly, the techs were probably my like the biggest teachers for me over residents and especially attendings. Techs are the ones that actually give you like everything, and then like if you become friends with them like pretty quickly on, like they'll give you enough tips and tricks to like try and impress the attendings, and they'll be like, oh, by the way, this attending likes it this way. Um, so that's the kind of thing. And some places the techs are a little more protective or like kind of have like a separate culture from the students. So like again, like being as like non-combative and trying to like disarm some of them. Some of them can be a little bit more protective. So you just have to kind of like approach them each in their unique ways.
Yeah, I agree. I think first and foremost, walk in without an ego, and just be normal. That goes a far way. When I say that, just say good morning, hi, I'm the student, introduce yourself to everyone. It feels very uncomfortable the first couple times because like you're the outsider, no one knows your name, and they're all doing their thing, they're all at work, right? So, but don't be afraid. Just be like, hey, I'm new here. This is my first day. Most of them are nice about it, and you'll always run into someone that's not. Just brush it off. It's nothing you did, right? If you're brand new to the IR suite, I think just some easy tips and tricks, know how to self glove and self gown. There's a lot of great videos on that too, or just asking, you know, someone at your home program or another student that did a rotation. I mean, that's like just something simple that you can kind of impress someone on your first day, just knowing how to put your own sterile gloves and gown on. And then don't be afraid to ask because like every tech is very different. Some techs are super protective of their table, don't touch their tables. Others are like, no, it's your table, do whatever. So I think it's especially in the beginning, just ask like, hey, can I, or like, how do you want me to do this or that? Like, do you want me to run the table? Do you want to run the back table? Or just be like, hey, I've never run the back table before. Can you show me a couple of things, right? I think just being open and asking questions and just being engaged, it's going to be very uncomfortable the first couple of days, couple of weeks, but you will get the hang of it so quickly. And before you know it, you'll be hooping wires like a pro.
Yeah, I completely agree with everything that was said. The one thing that I would add is that sometimes there are going to be really competitive techs that no matter how much skills you learn, they will still not let you near their table. And that's okay. It's not unique to IR. There's a ton of surgical and procedural specialties that are like that. I think the biggest thing you got to realize is when you're encountering a situation like that, if you feel like you're not getting much out of being able to back table or the tech is not allowing you to, maybe it's best, even if it's a big, really rare or unique case, maybe it's best to go to switch out for a different case, right? Because at the end of the day, the more and more you practice your back table skills, the more and more you get comfortable with not only the tools of the trade, but learning what are the steps of each procedure. Then your confidence will gain to the point where, hey, maybe that combative tech realizes, hey, this guy knows what he's doing. This girl knows the steps of the procedure. Maybe I can let him do a couple things, right? So it's really just knowing when to say no, when to step back and go to do something else for the sake of your learning experience. And then I'll also add to that, of course, even though so much of it comes by hands-on skills, there's a lot you can do just by studying at home and learning the basic tool of the trade, learning the purposes of each wire and catheter, so that when you do get to that point of backtabling, you're confident, right? You have that knowledge and that ability. And so that's a shameless plug for the Tools of the Trade lecture on our YouTube channel. Definitely go check it out. It's a good review for anyone who's starting out in away rotations.
Awesome. Yeah, you guys highlighted a lot of good things, like being friendly, like Camille said, and like just I think just being human and like being a normal person like helps. It goes a long way. I think the ego thing also, like you guys mentioned, is huge. Um, so can you guys kind of give a like day in the life of like what the day before every case looks like? What do you guys do to prepare for cases? Like how, like yeah, what do you guys do to kind of help you be successful the next day?
I mean, I guess the one of the first things, it really depends on your co-rotators, but something that I always preferred, but like sometimes it wouldn't always happen is we split it like the week or the day before. Sometimes like a lot of there's one or two rotations where we'd split up the day of, which wasn't always ideal. But it was fine because it was like towards later on where it's like you've seen most of these cases, so it's kind of plug and play. But yeah, kind of just like one of the biggest things for me was a lot of the textbooks and like there's like three different textbooks that like people will go by. I just had Kandarpa just to um just that was like the one that was recommended to me. I used it, but to be honest, like a lot of the steps sometimes doesn't 100% align to what your attending is going to do. So like you don't need to memorize Kandarpa, just know kind of like there's like a few things that you can do is like just like looking at Kendar watching a YouTube video is always the best way for me is because it's like you at least get to understand what they're doing over like just reading, being like, oh, grab the X, Y, or and then it's like you don't know what they're talking about because they don't really have pictures or whatever. Um, and then I guess like one of the kind of like more quote unquote advanced ones is like reading up on the literature so that like if you ever get, pimped by an attending or even a resident, it's like you can kind of have like, like just like throwback studies at them. And then like, it's like a party trick, I guess.
Yeah, I would agree. I would heavily, for me personally, what I would do is if I knew the cases I was doing the day before, or at least was interested in seeing, I kind of relied a lot on IR Playbook. So I would read whatever the procedure was, whatever the intervention was, and really go through what are the indications, what are the contraindications, the steps, all that information that you can gather. And it's not about memorizing, it's more about understanding it. Because if you understand what the pathophysiology of disease is, what are the indications, and then it really makes those steps a little bit more clear of why you're doing things the way you're doing it and the order that you're doing it in. Another aspect to this, and this is something that you learn from your M3 rotations in surgery, is really knowing your patients. Because no matter how many textbooks you read, videos you watch, and steps you gain, right, it all varies based on the patient. And so if you know your patient really well, why they're here, what their clinical history is. You can kind of see how there might be adaptations to these steps and variability, right? And that kind of helps you really plan for things, or also know when not to do procedures and not to do certain steps.
Yeah, I agree with all that. And I think it is also very like dependent on how the days are split up. I've been on rotations where kind of like Faisal was saying, day of, day before would always be better because you get some time to just kind of like digest the information the night before. Um, that said, I kind of was between both Kandarpa, IR Playbook, and then just looking at the literature. Full disclosure, I worked in IR as a nurse prior to, so I have a little bit more experience with these procedures. So my advice might not be that great. However, I do also have a shameless plug. I did write a book called Interventional Radiology Fundamentals, that it's available to purchase on Amazon. It's very like dry to the point, like what a nurse, a tech, a medical trainee needs to know. So don't expect to read it and be like, oh, this is everything I need to know for the procedure. But it's a great like risk benefits, what this procedure even is, what are the very common steps. And it also has like, what's a wire, what's a catheter, what's a balloon, what even is IR, what's contrast, like very simple things. But I think just knowing the basics and knowing your patient, exactly like Zach said, that's what most of my attendings, if they ask a question to me, it's not like, what's the next step of this procedure? It's, well, why are we doing this for the patient? Or what does this patient have? Or did you look at the imaging before? Like that is huge. Like don't forget, just because we're proceduralists, just because we're like minimally invasive surgeons, we need to know our imaging too. Like that is 50% of all the procedures we do. We're using live fluoro, right? So you need to know what the pre-op imaging is showing, why we're doing this, right? So like that's really key too.
Awesome. Yeah. Yeah, you guys mentioned a lot of good points. And I'm on my surgery rotation, and like those are exact kind of similar things that attendings ask me is like, oh, why are we doing the procedure? Like what a part of this patient's history is indicated for the surgery. Where in the imaging, like, are we going to target for the surgery? So the surgery rotation, I feel like is really applicable, what everyone's saying. So there's a question. Oh, I guess Zach also answered, but I'll open up to the panelists. Joe asked if there's any good recs on anatomy review or like imaging anatomy.
So I mean, like for image anatomy, usually what I would do is I would just look up like, whatever, for example, like prostate artery embolization and just like look up on Google and they'll usually have like JVIR or whatever where it'll have it like all like labeled out and then you just have to like read in the like the annotations where it's like, oh, the internal pudendal is like looks like a, it'll look more of like an owl. Um, since everyone else plugged, what's it called? We're working, me and my friend from Brown, we're working on an app where it's like, not only is it going to be like procedural guys, but we're also trying to add, like figures where it's like um, specific angios of different patients, and then it'll have the anatomy mapped out where it's like, a lot of my questions, like for me personally, I don't know about you guys, but was just kind of like, they would do a quick run and then they'd be like, okay, so start labeling what's on the screen. And then, first two or three times you're kind of fumbling over yourself because again, it's like it's not always going to be like the textbooks. The guy can have like a weird anatomy or whatever, but like a lot of things will look the same, even if their origins aren't the same. You know, like kind of saying like obturator looks always like a Y or like an upside down Y and stuff like that, and just kind of like that's more important than like, oh, this comes off first and then this comes off second. Just look at the shapes is more important than the actual origins. And then again, for imaging reviews, just look on Google like prostate artery angiogram. It'll pull up a lot of great pictures.
Yeah, I really have nothing to add. I mainly used Google, and just put like angiogram after it or fluoroscopy or whatever. That usually would be sufficient for me.
Yeah, I threw in, I 100% agree with Google. You can easily find tons of, especially when you're on rotation in the middle of the day, just quickly Google it up. If you wanted some more dedicated imaging anatomy studying, which I don't necessarily recommend, you don't have to do it because probably it's not applicable until you get to residency. You do have to know your basic anatomy. But in my experience, at least, no attendings necessarily pimp me on anatomy unless it's like really, really common, easy, you should know this type of thing. Um, but if you wanted those recs, Radiopedia is a good one, just to quickly search up anatomy. And then KenHub, I think, has an imaging anatomy course that you can do, but it is paid. So um, do it that way you go.
Yeah, no, those are, thank you for sharing those resources. I think in the chat we've also like plugged Camille's book and like Faisal's app that he's working on. So if you guys want to check those out. Um, yeah, I'm sorry if I mispronounced your name, but Vedant has a question of like how can non-Vistal applicants navigate IR away rotation applications? They're targeting to do a rotation in May 2027 and November 2027, and they're not an US med student.
I mean, so obviously I don't have a great answer for this, but I actually had a Jordanian medical student stay with me when he came to rotate for neurology in Peoria. And like what it sounded like is just again like I think it's also kind of like how VSO applicant can kind of get it. It's not specifically the VSO application, it's a lot more like networking slash like if I feel bad for saying but like backdooring your way in. Like so reaching out to the program coordinators the med student attendings specifically, and just kind of emailing them and saying, I'm interested in doing an away rotation. Do you guys have spots open? Because that's usually how they fill it up, you know. I think even for VSLO, like when you apply for VSLO, it's not really like, oh, you have a great advantage. It's just first come, first serve. And I think that still applies for non-VSLO applicants, at least from my friend that came from Jordan. That's, you know, that's how he set up his viewership or whatever.
I think same. I don't think I have like a great answer for this, but I think it's like a lot of networking. If you have the opportunity to come to meetings, SIR is a great one to do. Since you're non-US, I'm not sure where from, but Cersei is a great one if you're in Europe. That also has great connections to America. And then if you're somewhere in like the Middle East, Pairs in Dubai is also a great meeting to go to. So I'd recommend any of those three if you're really trying to get like the biggest bang for your buck, just to kind of meet program directors, people that's going to be your easiest in, get an email from them. They'll connect you from with the program coordinator. And again, they're all going to be non-official aways, right? They're not going to go through the vSLO. So it's going to be kind of like a 2 week or 4 week or whatever you kind of navigate with the program coordinator, the program director, things of that nature.
Cool, thanks. Yeah, Camille, sorry, Camille, you're just going off so you mentioned the coordinator for the program. Is there a way that applicants can find that information out?
Typically just on the website. So like I know for Rush, if you just go like Rush IR or whatever, they usually have a coordinator email or at least a coordinator name or like the main email. Like it's like something like Rush at coordinator at like admissions.org or whatever. That's going to be your first point of contact. Again, hit or miss if they reply, I'm being honest, but you're just going to have to be kind of persistent. And that's why I said I think getting in touch with someone there, right? Like, oh, I talked with this attending and they gave me their email. Much more success with the, reaching out to the attending or a resident or an intern or whoever's at that program and having them connect you. Because everyone, any type of, connection, how strong or soft it can be, definitely gives you a leg up in comparison just to a cold email.
Gotcha. Thanks for the advice. Um, Another question that we have is like, can you explain the process of like asking a letter of recommendation on your ways? And did you meet with the program director at the start of your rotation or towards the end of it?
Actually, no, so
Go ahead,
exactly.
Faisal. Go
No,
ahead,
no, no,
Faisal.
no. I don't want to keep it. You go first. I'll go
All right,
last.
all right. Yeah, yeah. So, when it comes to letter of recommendations, personally, I've always had a rule of thumb where it's best to ask more towards the end. Obviously, you don't want to wait till the last day because that's a big scramble to get all the information together. And what if somebody doesn't agree, right? I would recommend that maybe towards the mid, let's say you're on a 4 week rotation, maybe the mid of the third week onwards, because at that point in time, whoever your attendings are, whoever your residents are, they've seen you work clinically, right? And if you go into the rotation asking for a letter recommendation, God forbid if you perform bad on one day, that might reflect really badly on your letter, knowing that, hey, these people are watching your performance for the purpose of a letter, right? Versus if you go in every single day, perform well, maybe you have a couple on and off days, and then later on you ask for a letter. I think that that reflects a little bit better, in my experience.
Totally agree with Zach. I would say somewhere in the beginning to middle. Definitely don't wait to the last week. I would say if it's a 4 week rotation, I think it's safe to ask on the end of week two, beginning of week three, just to give them ample time. And knowing that you probably won't get the letter by the end of week four, but just having that seed planted, and the earlier you can, they're going to start looking at you differently. They might be asking you more questions then. They might be, kind of not pimping you, but kind of stretching you to see what else you know. Like, is this someone that I really want to vouch for? Also, one thing I will say about letters of rec, very important. There's a fine balance between asking a letter from the person that has the big name in IR, right? The well-known person, and the person that you vibed most with and have worked the most with, and they have seen you perform the best at. Okay. There's nothing great about a generic letter, even if it comes from like the president of the SIR. There's nothing great about that. It doesn't matter if this person is like a newer attending, but if they write you a phenomenal letter, they're going to know you're a phenomenal candidate, right? So just keep that in mind too. A lot of people will go ask the same, attending, oh, because this attending has all these publications and blah, blah, but you've worked with them once or twice. They're going to write you a letter. They're not going to say no, but they're going to write you a generic letter. That's not going to get you anywhere. So it's really that balance between yes, if you did work with that attending a lot and they're the head of SCR, great. That's a perfect bonus. But don't just ask them for a letter because they have, all these titles behind their name, but you've only worked with them one day.
Yeah, I look, that's really a key point. A lot of people think that like they need to like, get, again, just quoting verbatim, SIR president doesn't really matter. Like some of my letters that I thought was gonna get a lot more comments, like well, the one letter that got one of my most comments was from like just a closer attending that like I think he was telling me about a bit before where it's like me and him were just doing a official declot and it was just like he was just like wait like that was like the one moment where I just saw like a student get it and like it's very rare that like a student gets like that. And then he was able to give that specific story and a lot of times a lot of the interviewers were kind of like oh take me through it or something like that. Um, just a little bit of different approach is so I he was actually the only one that I didn't have like pre-lined up if that makes sense. Like, um, I didn't really add like one of them was my mentor that me and Camille share, and then, um, yeah. So I would say like September 26th I think was our deadline of actually getting making sure you submit your ERAS. So like you know not totally in line with the question, but I would schedule your aways like before the 26th on the like basically thinking to yourself like September 10th or September 15th or whatever the 2 week mark before applications go live as being like that's when I have to ask regardless. Even if that's like you're at the end of your first week out on a rotation or whatever it is, it's like you need to get those at least two IR letters, ideally three or four is like you could have, but usually like a fourth one, usually you'll just get like an IM or a surgery or a GI or whatever it might be, just to kind of vouch for you for like other things. But definitely like just time wise, like just think putting it in the back of your head, September, I need to have all three or two or whatever letters ready.
Actually, just to make one more point, Faisal, you brought up a great point too. Um, One thing to consider is timelines. That's very, very important. A lot of people, like I did in a way after like ERAS was submitted, I knew I was not going to get a letter from that. Make sure you keep that into account because some people don't and be like, well, I'll just get one letter from each away, but it's like that last away is already after ERAS is submitted. And I know it sounds funny, but like just take a mental account of that because I almost made that mistake and was like, oh, I was gonna have a third letter from there, but I was like, wait, time out. I'm not gonna be in time. So that's important. And also a non-IR letter, I think from at least my mentors, it speaks volumes too. And it doesn't need to be a surgery letter. I got like a NICU attending to write me a letter because we just vibed really well and it was a great 2 weeks on service. I don't want to do NICU, but it was for whatever reason, like that attending and I just clashed well. And she wrote me a letter, so it can be whoever from your third year medical school experience or second year or whoever that you just clash well and they can speak on that behalf of you working well in a different environment. And also, I think that just shows that you're flexible too, right? And you're not just good in IR, you're good, kind of a well-rounded applicant.
Yeah. And then just to be a little bit more specific, so I had U Chicago in September, but I had an attendings letter from there from before. And then Michigan I had in October, and I just already knew that it's like I'm not going to be getting a letter of recommendation. It's going to be way too late. And even like with the U Chicago say I didn't have a letter, it would have been really cutting it close because it's like you only have 2 weeks to work with someone to get it. And then, for my non-specific letter, I actually had a GI that wrote me a, and like funnily enough, is two separate programs. They were classmates with that GI. So it's like like it was just like a very random, but it was like a very cool thing.
Yeah, and just to add to that too, one point I wanted to stress was really your non-IR letters also matter a ton. And it not only shows your skills in other specialties, but they can even speak to your passion in IR. So for example, I also got a DR letter, which, it's in the world of IR, a lot of programs are really splitting from DR. But at the end of the day, if a DR who's really well known, and is respected in the field, can speak to your passion for IR and how you were able to integrate that within your DR rotation, that also shows a really strong applicant, right? More than just your IR skills. Kind of like Faisal mentioned, you want to get a good amount of IR letters, but that should not be the whole of your application. Because more than likely, a PD is going to look at that. They're going to see maybe two of them, the rest of them they're going to ignore. And what if that one they ignore is the non-generic, really good one that speaks to your personality? And so you really want to spread the wealth a little bit, show your breadth across different skills, because that really is the heart of IR, right? We're not limited to any organ system or pathology for that matter. And so you want to be a very well-versed, well-rounded applicant. And that comes through for your letters by having different specialties.
Yeah, and I just last thing. Um, and that kind of ties back to like there's like three different types of IR letters that you can write or like you can ask for is, IR specific letter that you're submitting 100% to IR programs, like a 50-50 IR letter where it's like, oh, he has an interest in radiology, noted in interventional radiology. Or your third option is, and if you're really close to that mentor, is they write you an interventional radiology letter and a diagnostic radiology letter, and you kind of submit them both. I didn't really know about this, but like one of my letter writers, he called me up and he was like, "Do you want which one do you want?" And I was like, "Do they care?" And he's like, "Yeah, the DRs will hate if I write you an IR specific letter." So just kind of keep that in mind. And again, if you have a closer mentor, ask for the two if they wouldn't mind. And again, like the DR can be something that like, a lot of attendings I'm sure are just chat GBTing letters of recommendation. That one for a diagnostic wouldn't really matter, I don't think.
Yeah, you guys brought up a lot of good points. I like because my conception before this meeting was like I just need IR letters and that's it. So it's good to know that I can spread out to like IM or like breast, I don't know, surgery or something. That's good to know. Um, so Joe has another question. He said my classmates were told to avoid PD letters in their specialty. Is there anything else that you guys have noticed that should be kind of avoided.
I would agree with the, I mean, like me personally, I didn't get a single PD letter just because I know that's really popular and that's why I kind of avoid it is like they're like the first contact and it's like they're writing minimum, two, three, four, five, six letters. If you go to like again, like a lesser known that you vibed really well with, kind of like Camille was saying, um, I feel like that was better. I think that helped and then obviously if you just have like a personal connection to the PD, that's like like that's less self-sufficient at that point. So, but yeah, no other really strategies, no other people to avoid. Just avoid people that like kind of like the other two have Zach and Camille have mentioned is they're going to be asked by 10 students, 15 students. You're just going to get a copy and paste it. And again, like kind of talking about, there's one person that I know of, got a copy and pasted letter, and literally like their pronouns were wrong. So it's like it was a guy, and the letter writer just put she the entire time, and a few interviewers asked about that, and it didn't look too great on them. And obviously, like the applicant wasn't that happy with the letter writer.
That being said, too, it's a common misconception when you go to IROAs that you're gonna work with the PD and you're gonna work with like the program faculty. And to be honest with you guys, I don't know about Camille or Faisal's experience, but in my experience, you don't get to work with them. They might meet with you, they might see you a couple times, you might scrub into a couple of their cases, whatever it might be. But your main work is gonna be with the residents and the attendings that are there on a daily basis. The PD and the program leadership are often doing admin work. They're often busy taking care of their own respective residency programs. They don't necessarily have time for an M4 who's rotating on their way, even if you're interested in their program. So take really good caution about asking them for a letter, unless, like Faisal mentioned, you have some kind of connection, you did some kind of external projects with them or something, then I would consider it. But other than that, if you're just doing the rotation, I would say maybe look at other options before you consider asking the PD.
Yeah, I don't have much to add. I agree, with what Zach and Faisal have said. I would say to avoid anyone, I don't think there's anyone to avoid. I mean, obviously, if you didn't clash with an attending or someone, just don't ask them for a letter. I think that's self-explanatory. But again, if you did work with the PD or you have a personal connection to the PD or APD or whoever, it doesn't, again, titles don't matter. It's just whoever you clicked with the most and has seen you in your best, in your prime, right? Because we're all gonna have good days and bad days. That's another thing too. Any rotation you go through, there are gonna be days that you just shine and you just nailed every case and you nailed all the questions. And then there's gonna be days that, you just don't. You got every question wrong. You were in the way more than you were helpful, and that's also okay. And you just want to kind of maximize which attending did I work with the best that I did my best work with, and they acknowledged me enough and I feel confident that they can write me a good letter. Last thing too, and all the my mentors have said that they will tell, like, let's put it this way, the good attendings will tell you no if they can't write you a letter. And but the key is you ask them, can you write me a strong letter? Everyone can write you a letter, but if they can't write you a strong letter, not all of them, but most of them will tell you, I can write you a letter, but it's not going to be a strong one. Or, I don't feel comfortable writing you a strong letter or something. And again, don't take that as like, oh, that's a failure. Take that as respect for you because that just means maybe they didn't see you in your prime. You should ask someone else that can write you a strong letter, right? So just if that ever happens, just know that that is not a sign of weakness. That is actually great news because you rather go to someone that can give you an excellent letter than accept any subpar letter.
Awesome. Yeah, so I think Zach touched about a little bit about like the kind of misconceptions. I think another question that's brought up is like that there's an optimal number of away rotations to complete. Like people say around three or four is can sometimes be viewed negatively as you're potentially taking spots away from other students. What are your thoughts on that?
I don't think so. I think like three or four, again, like when people are saying like you're taking spots, I did two homes, technically Peoria and Chicago. So, but when people say like you're taking away, like no one cares. If anything, I think it's more of a positive that's showing that you're dedicating more months to IR. And again, it's like you're taking what one spot from it, like, like if you're doing two versus four, you're taking technically two spots. But again, a lot of the times, like those spots that you're taking is in maybe in October, maybe November, where it's like a lot of people are kind of dipping down at that point. Um, I think we're doing more rotations, but again, just being a little bit more selective on where you want to go. Don't just go to an IR rotation just because it's being offered. But I do think that the new like standard is usually like roughly three rotations, like either like a home and then two aways, something like that. Because again, it's like where you're matching is most likely where you rotate, or that's where you have the best chance. Whenever I'm interviewing at a place that I didn't rotate at, like in the back of my head, I'm thinking, they've had already 8 or 10 or 12 rotators that are probably going to be ranked above me, even if they're like, even if you're the number one IR in your entire class, like in the 2027 match. I think most programs would prefer that they have their rotators. Because again, it's like it's a 1 month of seeing you for who you are, and if you're weird or if you're, like you can't get along, even if you're the number one applicant, no one wants to take you because of that. So that's the thing. It's just, don't feel like you're taking too many spots. Same thing with interviews, take every single interview that you have. You're not holding it, anyone back from it.
Yeah, I would completely agree with that. You should maximize the amount that you can do for everything, interviews, rotations. That being said, like we were talking about in the beginning, and Faisal kind of touched on it. When you're doing these little ways, there is a cost behind it, right? You do have to figure out transportation. You do have to figure out housing, your food, right? And so if you can't afford that at a time, and that's the very real reality for a majority of people, then don't necessarily, worry about going on that IR rotation. Some two other points that I'd like to add with that is we touched on this a little bit earlier. Yes, you want to do your IR rotations as early as possible to maximize the letters and the face time you can get prior to ERAS submissions, but don't discount your IR rotations that you can do after ERAS is submitted. Sure, you might not get a letter on time. Sure, might be in the middle of interview season where things are busy, but at the same time, that's another opportunity for you to network, have face time with programs, and really get yourself out there and grow your IR experience. In my personal example, I did like a IR rotation, I think in December, which didn't expect a letter out of it, but it was with a program that I already had interviewed at. And so now, well past the interview, I'm getting a lot of FaceTime with them, which was, in my opinion, a very valuable thing. So even if you can't schedule it all in that summer, because every school has different schedules and different deadlines and requirements, don't be afraid to schedule it out in November, December if you're able to do that. Yeah.
Yeah, I agree. I always say more is better because you get more experience. I never view it as you're taking the opportunity away from someone. It's all an application, right? We kind of we all have to put our best foot forward, right? And it is expensive though, right? I will definitely say that is expensive. If you can start pre-planning, like I started planning that, hey, I want to do three away rotations. I know they're not going to be local to where I can just stay at home or I don't have relatives or something I can stay with. So I started pre-planning probably a year in advance and just started putting money away so that I'm not stressed out about the financial burden of it, right? And it is expensive. It does get expensive, I'm not going to lie. That said, I learned so much, not only about every program, but what I personally need out of a program. All the programs that I rotated at were fantastic. I think they're all great. I think, anyone that going through them is going to be a successful, amazing IR. But there are certain things each program had that me personally, I was like, well, I really like this. Or, I didn't realize that. So this program doesn't do it this way or doesn't have this. And I didn't realize how important that one thing was to me. And I don't think it's beneficial for me to tell you what those are because every person is going to have something unique, right? And it could be something so small, like what is the parking situation? What is the food situation, right? I mean, like there's little tiny nuances that some people care about, some people don't. What kind of procedures are you seeing? Do you care about that? Is it a combined workroom? Meaning, do all the residents and attending sit together or do they sit separately? I mean, it's little tiny things that you pick up on and you're like, oh, I didn't realize how important that is, or I even realized that's a thing here or there. So like that is something that I learned from all these ways. And I agree. I think that the places that you rotate, you're already just kind of seen higher, but also I think for your own self, because 6 years, 5 years, wherever you go, it's a long time. It's a long time to be at one place. So you want to make sure that you're a good fit and that they're a good fit for you. It's a two-way street, right? So as long, it's a month-long interview, as everyone says, but just be yourself and know that you're trying to figure out, can you see yourself here for that long, as well as they're trying to see, like, are you a person that fits our crew?
And then I know other people ask different questions, but one thing that I just remember thinking about when I was on my rotations is, do they want a signal? And no one wants to ask, the PD or the attendings or whatever, being like, oh, do you guys want a signal? Because if not, then I'll just apply to you guys. I'll get my interview, but I'm not going to signal you guys. That kind of gives off a bad, in my opinion, that gives off a bad uh like just have in your mind if you want to signal or if you don't want to signal. If you want to signal them and they're really one of your top ranks, don't be like, oh, just because I did a rotation, like Michigan, for example. Interviews came out when we were what's it called? When I was on rotation, and it was basically that even if you did a rotation but you didn't signal them, you wouldn't have been offered a interview, which was to me was pretty shocking. But again, it's just like don't ask or don't bring up those questions. Just kind of having your mind being like, is this a program after the month I like this signal? Go for it. Don't ask the pre to be like, oh, are you going to get interview if I don't signal you guys? Because that's going to show that you're not really interested in them. Um, and yeah,
To
and
to kind of go off of Faisal's point, I think a general really good rule of thumb, not just with your eye rotations, but any rotation you go on, is don't be overbearing. I think we've all, whether it's your M3 or your M4 rotations and your aways, we've all experienced that's one student who's just really, being overbearing to the residents, to the PDs, to the faculty, and nobody likes that, right? Nobody wants you. We all might have motives for going on a certain rotation or going to a certain place, but you don't need to verbalize that. Just there's a time and place for everything, right? And when you're on an away rotation, yeah, you're showing face, yeah, you're networking, yes, you're trying to get LORs and learn and experience things, but that's not the time. It's not like an interview, right? It's in the sense of you're not applying for residency in that very moment, right? And so don't treat it like that. You're there to learn, there to kind of, like everyone was saying, culture fit, which you're not really culture fitting if you're really focused on, hey, what's your signal process like? How can I get an interview? That's not really appropriate, I think, at any program that you can go to.
Agreed. And my one liner for what I always want out of a rotation. Number one, don't be in the way. Number two, be helpful. And three, learn something along the way. I mean, like that is the three key steps. If you do all three of those things, you're going to be successful in your rotation, right? No one wants an overbearing student that's in the way or, goes out of his or her way to do something that, hey, maybe you shouldn't be doing this because you're still a student. Like you still have to know your place, right? Like, yes, you want to be helpful, but you don't want to be in the way and you want to learn something along the way.
Yeah, I think that kind of ties to what Asher was asking. What are some examples of how you want to contribute to the workflow without slowing things down? One of the biggest things is consults. For example, like consults are ran differently in different away rotations. So, for example, one was in between your cases and whatever, you have to be helping like the junior residents, mainly diagnostics, with all the consults because they're the ones that are consenting or whatever. And if you're just going to cases back to back to back, and that's the expectation of you, the diagnostic residents are not going to be especially happy. And then they'll talk and like whatever. And another days is like the other thing is like you'll have consult days where again it's like you're just one-on-one. You're not going to a single procedures unless it's really quiet for whatever reason. And you're just like taking each one of those and kind of being like, okay, I'll write the note for this. I'll take this full responsibility. And, like you're trying to make the resident look better in front of the attendings. And like, for example, I heard a story about this. I don't know 100% if it's accurate or whatever, but one of the places I rotated, person was skipping out on their consult days, you know, the attending said that, oh, I love you, X, Y, and Z. Like this is having like I have a great relationship. The resident started complaining like afterwards, after the rotation supposedly, and that person's a DNR. So again, like don't be like, oh, I need to be in the face of all the attendings and showing them my skills and all these things. Because if you start like cutting in corners and trying to like getting out of the admin work or whatever, that's going to come back at you. And yeah, again, that of you scrubbing in and doing all these things could go down the drain because you didn't spend 2 days on consults. Um, so I think that's the main thing. You're always going to be like, unfortunately, a nuisance. Like even if you're not a nuisance and you're like, oh, I have 10 months of IR on my belt, and you start trying to be, you know, imposing that on the techs or the nurses, that's the only way that you're going to be a nuisance. If you're just standing in the way, trying to like get out of your way and like be like, oh, do you need any help? Do you just want me to fill up the saline or the contrast syringes? Yeah, you're technically like getting in the way and like, but like no one's gonna see that as getting in the way. People are just gonna see, oh, he's trying to be helpful, he's trying to be a team player, and that's it. Um, so yeah, just like the two things that you would get in the way is cutting corners to try and impress people, or thinking too much of yourself, or even if you're that guy, being super confident and like imposing on everyone else, that's the way that you're gonna get in trouble a lot.
Yeah, to Faisal's point about cutting corners, you'd be surprised, right? When you're an M3, you're sitting there dreaming about when you're the resident, you're able to do, let's say you're on surgery, that you're the surgeon, right? That you're the one who's leading the procedure. The truth of the matter is until you're like a PGY, in IR's case, until you're a five, you're not doing the procedure at all. And you're not touching anything. And so the reality is your fundamentals from M3 year onwards is what you're going to be honing for the majority of your M4 year as well as for first few years of residency. And so what are those fundamentals? It's going back to what I said earlier, is knowing your patients. It could be as simple as, for example, on one of my rotations, the resident was busy in the case. He didn't have time to read up on a consult. We're going into the case. Attending goes and asks the resident, "Hey, what's this person's history? Like, how many cancer? What is the cancer history?" And I just happen to read up on it. And so I just turn around. It's not the case I'm scrubbing into, and I go and tell the resident, right? And he's able to update the attending and kind of get himself ready. And so that little thing like that of doing your fundamentals, knowing your patients, right, is what will set you apart, right? And is how you can be helpful without getting in the way. If anything, it's supporting the residents in their job. And then kind of like Faisal mentioned, the basic back table skills. It seems silly. We all want to get past filling the syringes with saline and contrast or handing the attending the wire, right? But at the end of the day, that's how you can be helpful because you're not going to be allowed to do a lot of the majority of the stuff. It's not about kind of like what Faisal said too. You can have 10 months of IR under your belt. You can know exactly how the steps of every procedure. They're still not going to let you do it because it's a liability. It's a legal issue, right? It's not about your skill level. It's not about how confident you are, how the attendings have seen you. It's simply just the legal issues that come with that. And so the reality is master your back table skills and then know when to step back.
One other thing I'll add, 100% agree with what both of you have been saying. Um, with workflow too, de again, very program dependent. One thing that I feel like the nurses and techs will love you for is if you stay and help take the patient off the table. I mean, that is such a simple thing. Help slide them over. Or, and again, very, very tech and nurse driven specific. So always ask for you to do anything. Some of them would love if you threw your sharps away. Some of them would love if you take your table down after the case. The resident and the attending want to go scrub out and do whatever they need to, right? Follow-ups, next case, whatever, whatever. You as a student have extra time to sit down and do that extra thing. That helps with workflow, and that also gets the nurses and techs on your side. And also, again, the residents and attendings notice, and they will talk, if not directly to you, behind you or whatnot. And then the last thing too, if you're with a co-student, you guys need to work together, right? Just work together. This is not, you guys are not competing. This is not a competition for who's going to get this IR spot. You want to make each other shine, bounce ideas off each other, support each other. If you don't know the answer to a question, but your co-student does, lean on her, lean on him, vice versa, right? Like that is only going to go, hey, I didn't have time to read up on kyphos. Do you know what a kypho is? Can you explain it to me really quick? I mean, people listen, people hear, and you're not in a silo, right? You're in a workroom with different residents, attendings, fellows, all that, and they hear all those conversations. So always be kind to everyone, and just again, that's key, right? That teamwork, that workflow.
Yeah, and like talking about the co-students, it's like something like for me, I was just the type of person where I was just like, if someone wants to go to a case, I'll just suck my pride in. And there's like one time that I wanted to go to a case, right? And my co-student, like they had their like wait for the past month or whatever. And it's like they weren't willing to give it up. So I was like, okay, I don't really care. You're gonna have those people, and like even like some co-students, you're gonna feel like they're friendly, but they're also competing. At the end of the day, just like, you know, always just kind of back off, I guess. Some people are super competitive and that's gonna show on them. Like, I heard some residents talking about like a student or here and there or whatever, where it's like that type of competitiveness comes and it shows through. People aren't dumb. Um, always like, yeah, you want to be competitive, but don't like cut someone's throat for it. And then with that also, one of the other things that like Russ, what's it called? Residents really loved is being like the point person for other teams for console. So it's like not even just being like, oh, work this up and present it to the attending, then write the note. But like sometimes it's like, oh, we need further clarification. And the resident's like, okay, I'm gonna go call them or whatever. Me, M3 year, I hated calling consults. To be honest, I avoided it as much as possible. I didn't want to be that person or whatever. But like on my aways, like I was like, oh yeah, I can message them or I can do whatever. And it's like sometimes it's like they'd ask me like the consult or whatever would ask me like 10 questions and then I'd like, okay, like I'm gonna add my resident to this. But I feel like that had the best outcome because again, it's like they have like 10 other people to call. So if you can like, message on someone on Epic or whatever, that's like the best you know, like I did that a few times for one resident and it's like we were working up one console and he told me he was like, oh, by the way, our attending, he always loves to ask this question, like for this type of console or whatever. And it was like, oh, like what's the complication for this specific? Like what are the two or whatever it was. Um, and then like the attendant comes in, sure enough, like 10 minutes into the console, like we're like me, whatever he ends up like turning to me and like asking the question, and literally verbatim the question. I started like smirking, and I was like, I said them both. He's like, oh wow, like everyone that I ever asked that question, like they always get the first part, but then not the second part. Like wow, like you're really just built different. I was like, and I just think like me, like as soon as the attending left, me and him were just laughing because it's like he just set me up for a dunk, to be honest. So just doing that, like it'll pay its dividends.
Okay, awesome. Yeah, 702, and you guys have been sharing so much wisdom. Like, I don't want this to stop, but I think it should be respectful for your guys' time and also like the audience's time as well. Also, I just want to say again, thank you so much for your insight, your wisdom, and Jason also mentioned like you guys are awesome, like M4 like models. I think we all aspire to be like as knowledgeable as you guys. And honestly. Hopefully we'll be able to celebrate when you guys match. I'm excited where everyone goes. Thank you again for taking the time. And thank you everyone in the audience as well.